Hello everyone, I'm going to be discussing one ethical dilemma that I experienced. Although this did not happen during one of my clinical rotations, it did happen to me at my job in a hospital. So one of my patients, they were over 100 years old and they came in to the hospital for a hip replacement surgery. During their stay, they were unable to walk, so they were bedbound. They had diabetes, and that was making it difficult for them to heal from the surgery. And they also had a very long history of dementia. At the beginning of this individual's stay, they were a full code. The doctor, the charge nurse, the other nurse taking care of this patient, and myself, the aide, noticed that the patient's condition was declining. The person's vital signs were showing that they had low blood pressure, high fevers. The patient wasn't healing properly from the surgery due to the diabetes, and their symptoms of dementia were worsening. When we started to notice this, we began to have discussions as to what the next best step would be, and ultimately we decided to have the provider and the charge nurse talk to the patient's family in order to figure out what would be best for this patient and what the patient would have wanted for themselves. Although this was a hard discussion, the family and staff came to the conclusion that it would be better for the patient to be placed on end-of-life care and that they would be taken care of by hospice nurses and the family at their house. This allowed for the family to spend more time with the patient, along with giving them a more peaceful at-home death. At the end of this experience, the patient ended up going home on hospice care. I feel as though this was the best outcome for this situation because the patient was able to pass away peacefully in their own home rather than being put through like CPR and other life-saving measures and possibly dying at the hospital. Being a part of and witnessing the outcomes of the situation helped me a lot in understanding how to be an advocate for patients, especially when they're not able to speak for themselves. It is important as future nurses to keep the code of ethics and best practice in mind when providing patient care.